We now speak to Paediatrician Dr Delano Rhode at MeloTV Belleville, who speaks to us about their concerns and has sound advice to you as a parent. But joining us right now, MeloTV, is Dr Delano Rhode, a paediatrician right at MeloTV Belleville. Dr Rhode, World Premi Day and being a premature baby, for any parent, that is a special time.
Yes, Gershon, indeed. Premature babies, they are little miracle babies. They come unexpectedly. They're like a little gift of dynamite. So they are just our little precious ones. You know, any baby is precious, but premature baby that makes it through life, like yourself, there's a little bit of a extra sort of tip on the, a little bit of icing on the tip of the cake there. So yeah.
How has technology changed? I mean, I was born in 1977. We're now 2018 going into 2019. How has technology changed that can help a parent during this period? Because, as you said, also babies do come earlier.
Yes, so the definition of a premature baby is any baby born before the age or gestational age of 37 weeks. So they always come unexpectedly. There's here and there where you can start planning, depending on the cause of the premature delivery. So it's developed remarkably over the last 50 years plus. If you take it 50 years ago, your chances of survival is minimal. Nowadays, you're looking at less than 30 weeks, 28 weeks, and we're taking it easy. We can plan, we know how to manage, we know what to expect. And we do have the facilities and equipment to manage those babies depending on the condition that they're born with. So we've come a long way. We've looked at, instead of just looking at medical management, we're looking at the multidisciplinary support from our nurses, our occupational therapists, our speech, language therapists, our hearing, the ophthalmology team, the neurological team, the development team. So we've really expanded this field of neonatology. There's still a lot to explore, but it's currently what we can offer the parents is amazing.
Dr. Rhode, it is 2018. There are so many pressures at work, at home, life itself. What are the onsets of a premature baby?
So yes, we have to look at it from the mom who's hosting the baby and during a pregnancy. So you look at the condition of the mom, the health of the mom, medical history. Does she smoke? Does she ingest any form of alcohol? Is there any specific medication or drugs that she uses during pregnancy that can lead to premature delivery? We look at medical conditions like hypertension or diabetes during pregnancy, and then we look at certain infections that can occur during pregnancy, such as your bladder infections or urinary tract infections or your bacterial vaginosis. We also need to look at the baby itself. Does the baby have any what we call congenital infections that can lead to premature delivery, any congenital or syndromes that can lead to premature delivery. So it's a whole investigation process that antenatally mom goes through to determine what risk classification she has, that can help us possibly in determining and getting ready for a premature delivery.
How important is the support structure from husband and family?
The whole family setup. I always say there's three aspects to any family. That's the two individuals as a family. So husband is always important. The support from the husband, the support from the family. The mom delivering the baby, we always have to support her, because who's going to ask the questions first? Not to the baby, but to herself, in terms of what did I do wrong? Did I do anything wrong? What if I did it this way? What if I did it that way? So in terms of premature baby, most cases the preventable aspects of delivering a baby prematurely has been discussed by the obstetrician with the mom, and it's usually been voided by then. But you do get some instances where a little bladder infection triggered, and it just needs counseling with the mom and reassuring her, that the premature delivery took place now, but we've got your hand, we've got your back, and that is the role of the father and the family. So psychologically, it is difficult because it means baby might spend in hospital up to 3 months, sometimes more, and we need to make sure that the baby's feeding is properly, the breathing is fine, the ability to maintain temperature well is good. So we look at all those factors, including the risk for infection during that period of premature growth.
Dr. Rhode, for anyone planning a baby and anyone falling pregnant for the first time or second time, the first 90 days are important. It's the risk period. But can a premature pregnancy be avoided?
Gershwin, yes. I think if you look at the avoidable factors in a mom's health condition, such as making sure risk factors such as smoking, alcohol intake is avoided, as well as living a healthy lifestyle, so making sure whichever medication you take, be it vitamins to antibiotics to any tablets that you use generally, making sure it's not harmful towards your baby, towards your own health, making sure you attend a good antenatal program with your nursing sister and a obstetrician, getting ready in terms of where you're going to deliver, making sure that if you deliver that there's the facilities in place in terms of a neonatal intensive care unit with the facilities to manage a premature delivery and a premature baby. The advice I can give to our first time moms is that they need to relax around their baby and accept support from their family. And the reason for this is they act like lionesses sometimes, which isn't wrong, but they need to accept that they need to go rest, they need to take their time out, and while they do that time out is to hand the baby over to a trusting factor such as the husband, such as the grandparents or friends that they trust, just to get their little time to remember that a healthy mom is a sound baby. So if you're not healthy, you won't be able to take care of your baby. So remember that, moms.
Dr. Delano Rhode, thank you so much for joining us right here on MeloTV, and thank you so much for your advice.
Thank you, Gershwin. Nice being here again.
Well, there you heard in the video that I myself am a preemie baby, and today 41 years old and healthy. We hope the advice you received from Dr. Delano Rhode was helpful. From all of us at Melamed Hospitals, thank you for watching this video. Until next time, goodbye.